Pain. Pain is one of the most common symptoms in the general population, so it's no surprise that it's commonly reported after a traffic collision. Pain is largely subjective and has many overlapping causes. Traditional treatment and management of chronic conditions, including chronic pain, has been relatively unsuccessful. Pain does not depend on what is happening in the tissue. Pain depends on what the brain thinks is happening in the tissue. Pain is defined by the International Association for the Study of Pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. Chronic pain is pain that continues when it should not. The following points are important to understand about pain. 1. The reporting of pain may or may not involve tissue damage. 2. There is not always a proportional relationship between tissue damage and pain perception. 3. The relationship between pain and the state of the tissue damage becomes less predictable the longer the pain persists. 4. Our nervous system is plastic, or constantly changing. 5. Pain is modulated by many factors from across somatic, psychological, and social realms. 6. Pain should be classified by physiology: acute tissue damage pain, eudynia; chronic destructive pain, maldynia; or mixed pain. 7. Chronic pain can influence other body systems. 8. To reduce acute pain, we need to reduce the perception of danger and increase perception of safety in the brain. 9. There is growing evidence to support that for many patients with chronic pain, targeting the beliefs and behaviors that drive pain and disability is more effective than simply treating the symptoms of pain. 10. Preventing acute pain from progressing to chronic pain is essential. Pain perception is the state of being or process of becoming aware of a danger through the senses. The pain experience is a mental processing of the pain perception as combinations of thought, perception, memory, emotion, motivation, and imagination. This includes conscious and unconscious brain processes. Catastrophizing, fear, and worry about pain will actually create the very pain that you fear. The majority of patients involved in traffic collisions will recover, but many will have continued symptoms. Important predictors of chronic pain following traffic collisions relate to psychosocial factors and aspects of health. Surprisingly, the bulk of evidence suggests that crash-related factors, for example impact direction, awareness of collision, and head position, are not associated with the prognosis or development of chronic pain.